Hi, Dr. Karan. How are you?
Good. How are you?
Good, guys. This is Dr. Karan Law. He is a dermatologist, and I'll let him tell more about himself to you guys as well. But he's here to kind of share his perspective as a dermatologist and kind of insight into the Closer Look project. So we'll start with an introduction. Why don't you tell me a little bit about yourself and tell the viewers a little bit about yourself?
Yeah, so I am Karan Lal. I'm a board certified dermatologist. I'm board certified in both general dermatology as well as pediatric dermatology. I've also done a cosmetic surgery fellowship, so I do a lot of cosmetic procedures. My practice is mixed medical and cosmetic, and it's about 50 and 50%. And I see a lot of hair. I think we're gonna talk about some trends that we both have encountered in clinical practice with people, whether it's for lesions in the hair or hair disorders.
Okay. And so I follow you on Instagram. I see the stuff that you're a part of. You're a pretty powerful advocate in the dermatology space and skin cancer space as well. Can you share some campaigns or educational efforts that you've been a part of in cancer prevention?
Yeah, I mean, I'm in Arizona. Arizona is like the skin cancer capital of the United States.
Yes.
So, my practice is basically has the Arizona Skin Cancer Foundation. So they do a lot of skin cancer screenings for free, and they treat a number of patients that can't get these procedures done in underserved communities. Um, in general, I also do a lot of events in the community, giving out sunscreen, sun protection. I myself recently was with La Roche-Posay, was able to be at the front runners race on during Pride Month in June, and I was handing out
That's
sunscreens
awesome.
and doing skin cancer screenings at the booth. So a lot of these opportunities come up, and I love doing them because the reality is, I think a lot of people, even if they have access to a dermatologist, don't often see them, or it can take a long time to see somebody. And that's why I'm on social media, because it kind of gets people the access that they need. Social
Yeah.
media in general probably is my biggest effort and job outside of my regular job. It is a full time job, educating people, interacting with people. I think my content is very different. I'm not what I would say a true influencer. I'm more of an
Mhm.
academic influencer. I am the director of pediatric dermatology for a residency program here locally. So I teach residents. I'm very academic. I do clinical trials. I do research. And then I also have this line, on social media where I kind of show people like more than what comes to seeing me, and that involves part of my personal life, the things that I do, the things that I care about, because a lot of those things have a downstream effect. And so if people see me being healthy, doing healthy skin behaviors, healthy activities outside, it has a trickle down effect. So you kind of have to be an advocate for people by being an advocate for yourself first.
Yeah, absolutely. I love that, and I think that you're so right. Your content is so different. I think I saw you talking about oxidative stress with vitamin C serum on a story, and I'm like, that's content first, like a post, because you
Yeah.
put so much into all of your content, and I
Yeah.
think a lot of people would admire that. So yeah, and in terms of you doing those screenings at like outside events, if you see something that looks malignant, what's your recommendation to those people?
Usually it depends on what you're doing. I use the form that's provided by the AAD. I think it's the spot form. So usually we would tell people like we think that the spot needs to be examined further. And so we'll send them to the dermatologist or help them find a dermatologist so that they can get access to that care. And I think like, in my practice, I'll be honest, like the nurse practitioners and physician assistants kill it at finding skin cancer. They
Yeah.
probably catch more skin cancer than I do because in my practice, I don't do as many skin checks. Most of my patients are inflammatory diseases. So if
Right.
I find something, it's going to be in a patient that has a chronic inflammatory skin disease. But like the PAs and NPs in my practice, they're catching like 10 to 20 skin cancers a day.
Yeah,
So
it's
it's
crazy.
it's crazy, and it's a lot of like what you see. It's a repetitive understanding, dermoscopy, and there are people out there that trichologists where they study hair, and
Yeah.
part of their curriculum is also recognizing what's not normal. Now, in my practice, when I see a lot of things on the scalp, I often see them in kids. So people, barbers will say, "Oh my gosh, that mole looks really weird," and it's pretty interesting. A lot of things on kids look very different, and so moles that look
Hmm.
abnormal in kids actually are relatively safe. And this is not me providing a universal statement, but usually it's the ones that look funky in kids that end up looking okay. And it's
Yeah.
more like the ones that are like benign looking in kids are the ones that are usually the more scary ones. So the
Yeah.
rules for adults don't apply for kids. So it's very different.
Yeah, when I first started practicing, I biopsied so many like congenital nevi.
Yeah.
So I was like, yeah, this is cancer. This is melanoma. I mean, I didn't say
Yeah.
that to them, but yeah, like it's crazy. Kids are so different. That's actually a good point. Going into the kids. Do you feel that there's an increase in skin cancer rates in younger patients, like the younger demographic, or no?
I think that we're seeing that there's younger and younger patients that are getting diagnosed with skin cancer. I won't say pediatric patients, but definitely the 20-year-olds, 25-year-olds, 30-year-olds. Probably because A, we have better detection, where
Yeah.
people are coming in more. There's better awareness and knowledge about these things. And I think that that 30 to 40-year age range is the age of people that maybe like even when I was growing up, like sunscreen, which is not, I'm old, but I'm not that old. I'm 34. I don't remember my parents ever being like, "Oh, you need to wear sunscreen." So I was still in that generation of time. So I think my generation is still at risk. I mean, I've diagnosed a 21-year-old with a basal cell skin cancer here in Arizona,
Yeah.
which on the East Coast to me is abnormal. I also think it's interesting. I'm seeing a lot of kids that are actually now tanning routinely. They are
Wow.
going outside. They're doing the same thing that people did 50 years ago. They're trying to get some color. They're trying to get a base tan. And, a lot of these kids often I see them and they're on Accutane and then they go outside and they sit outside and not realize like being in the Arizona sun for 20 minutes is like super dangerous.
Very
And
dangerous.
so I
Yeah.
think these behaviors that we have educated people about, and adults pretty much know, like all their parents know, but teenagers are going to be teenagers. We also know that
Right.
for some odd reason, people in the LGBTQ community, I can't say this as a universal, but being on hormone treatment and hormone replacement treatment can also make your moles look funky. And
Yeah.
also, certain populations like gay men have very high risk behaviors of being out in the sun. And so, I will tell you, just and we, this is something we wanted to study is when you biopsy them, I just find nastier looking moles in gay men than I do in non-gay
Yeah.
men.
I have
And
two
it's
for sure.
yeah, and it's very interesting. So it's all very complicated.
Yeah. Yeah. That's a good generalization, though. Yeah. Thank you. Um, okay. So speaking back about, you said you don't remember your parents saying, "Oh, make sure you're wearing sunscreen." I don't know that I do either. I know my mom put sunscreen on me, I'm sure, but I don't remember that being like a huge, driving point growing up. So if you could go back and tell your younger self something about your skin protection, what would that be?
I mean, I will tell you for the most part, I don't remember, I also culturally come from a culture where like being darker is frowned upon. So I
Yeah.
never really ever thought about being out in the sun too long. I like, I'm sure we played outside, but I'm also, I have more melanin in my skin in general. So not to say that I was at a lower risk, I just think that I was also not the most athletic kid. So I was probably lazy and only went out in the shade. But like we never really did a lot of beach activities. Like, I'm not a beach person, I never have been. So for me, I don't think that I actually did many bad behaviors in terms of like I never gotten a sunburn as a
Wow.
kid. I've never done any of those, I've never had, so I can't say that I was ever in that position. So I don't think, even though I didn't have that education, that I put myself in a situation where I could go back and say, oh, I wish I could have done this for my skin.
Yeah. Good. Good for you. That's great. I can recall several sunburns, so that's wonderful for you. So do you think that most people still underestimate like the year-round effect of UV radiation?
Yes. I mean,
Yeah.
people all the time are like, oh, I don't really go outside. Or oh, it's like winter, and I'm like, especially if you live in a snowy area, that snow is reflecting UV,
Yeah.
and UV radiation even on a cloudy day is still present. So I think people do, but I think there is also a lot of good practices. Like there's a lot of good moisturizers now that have sunscreen in them. So I think if people just get used to doing that, then they don't need to think about it twice,
Yeah.
especially if you live in a place like Seattle, or Vancouver, or you live in these areas where they don't get that much sun all year round. Just having that alone is better than nothing.
Yeah, I totally agree. I wear like a little bucket hat anytime that I take my dog out, and I get like in the wintertime I get crazy looks, but I mean it's just protection. So
Yeah.
okay, so moving into the topic of the Closer Look project, I know that in my experience, some of my colleagues have kind of shunned the idea that hairdressers can be of importance in diagnosing or early detection of skin cancer. In your opinion, do you have any type of preconceived notion or feeling about that?
I will tell you, this is me being very honest. I think early in your career, when you put so much effort into things and learning things, um, you feel like that in the beginning.
Hmm.
Um, and that's just the truth, right? Like you feel like
Right? Yeah.
I'm the person. um, but then you realize, like, in the real world, right? Like, that's not, any help is better than nothing. And
Yeah.
also, like, there are women I know and men who see their hairdressers, barbers, whatever, way more than they see me. And
Yeah.
they're getting their scalp looked at once a month, once every 4 to 6 weeks. So they may not know what to look for, but if they're seeing things, I think this is where we talk about repetitive things. If you
Right.
see something long enough and it looks the same, your mind will probably say it's been there a long time, it looks the same, it doesn't, it's not dangerous. But when people start recognizing changes or things that are bleeding or things that look ugly, I don't know why you wouldn't take someone else's, like, common sense thought
Right.
into consideration. And I will
Yeah.
tell you, I've had the same situation where, for the most part, the accuracy is like 80%. 8 out of 10 times, like, when they notice something, it's something that is of
Right.
significance, you
Yeah,
know?
because like you said, it's unusual. So, yeah, I totally agree, and I think I've had that experience, especially when I first started practicing too. I'd have someone come in with their parent and try to point out all these lesions to me, and I would get annoyed because I'm like, yeah, I went to school for this. I know what I'm doing. I've been trained with this in this disease process, and but that is kind of a I think an earlier on perspective, like you said. I love your perspective now because, yeah, the goal is never for them to diagnose a skin cancer, but to notice something's changing and mention it. That's it. That's it. So,
Yeah, and I think that you always should have an open mind. Like, I will tell you, and I've learned this even from my parents. Like, my mom is not a doctor, my dad is not a doctor, but, like, they know things, and people have instinct. And I
yeah,
think instinct, like, when a parent comes in or someone comes in and they say, like, I'm worried about this, the worst thing you can say is no. Like, I will tell
right.
you, even from my own experiences, just having an open mind, you'll learn way more and you'll gain more
Oh, yeah.
trust, because there's also a lot of distrust in the medical community. I guarantee you, my patients trust their hairdresser more than they trust me.
Yeah.
By
So why
vir-
not equip them with those resources, right?
yeah,
Yeah, I agree. That's so true. I remember one case. I had a patient who had these, I would call them matte telangiectasias on the face, and they were all over. They were random. They were not painful, and I just assumed that it could be from, hormone changes and so I kind of chopped it up. Well, she said, I feel like something's really off in my body. Will you do some more tests? So I ran like an ANA and autoimmune panels, and she had lupus. And so like
yep,
that's so true. Like keeping an open mind. If a patient says to you, "Yeah, something's not right," they know their bodies more than we do, right? So
yeah.
um, it's so important. And I think you have a good perspective. Not a lot of physicians have that same perspective
Well,
as
I
you.
think it takes a long time. I think it takes for you to get burned a couple of times for you to recognize that. Like, I've been
Yeah,
burned a couple of times, and I think a lot of people, at a certain stage, we're also in the medical community, like I said, fighting a lot of misinformation, and so
yeah,
our guards are up. So, like, when people come in and they want to bring a question about vaccination, the door, like, it's over. We're not having this discussion.
yep,
So there are certain things for me where I'm very firm, but then there are other things where I really am very much like, you need to listen and
yes,
hear and educate, as opposed to be condescending, which is
yeah,
very easy to do because already people put you on this pedestal. So you may
yeah,
not realize the way you say something and how it comes across.
yeah. That's so true. How long have you been practicing?
Outside of residency, it's been 5 years. Outside of fellowship, almost 3 years.
Wow, that's awesome.
But
Okay,
again, I made my mistakes, and that's why I am the way I am now. I think,
right.
and people will tell me this, like, for your career, you're very advanced, and it's because I think when I came out, I was so some people when they graduate, they're very much scared to do things. I was the
Yeah,
opposite. I was the
you
opposite.
have
I
to
was like,
be.
I'm doing everything,
Yeah.
and I'm sure I did make mistakes, and I got burned, and now that shifts the way I do things.
Yep, I love that. Good for you. You said you have like very like sturdy, firm opinions on some things, and then some things are open. Beef tallow.
Beef
I'm
tallow is an
I'm
absolute,
kidding. I'm kidding.
yeah.
I'm kidding. I'm kidding. I wasn't trying to trigger you. I hate beef tallow, and I hate when people talk about it, because they've already made their mind up, right? So
Yeah, they've made up their
whatever.
mind. Exactly.
Yeah. So, okay. So, so we've talked about, keeping an open mind, listening if someone's hairdresser or their manicurist or their massage therapist says something's changing, right? We don't expect them to say, oh, this is a basal cell. So do you feel like a program or a project geared toward providing them with resources for that is attainable?
Yeah, I mean, I think it's common things. Like even when I teach my medical students, I'm not teaching them like all the words and the language that I know.
Right.
I'm like, do you see that this is like it's bleeding? There's an ulcer in the center. It's shiny.
Mm-hmm.
Those are things that that's a worrisome thing. You see something that is so crusty and thick. I mean, for me, the number one easy thing is pain. Like
Yeah,
when
for
people
sure.
come in, I have people come in that probably have 50 squames. Okay, they have 50 squames. Why do I biopsy some and not the others?
Yeah,
I know that I can probably get away with field treating some of them, but if there's pain, then I worry about perineural involvement. I worry that
exactly.
this is going to a deeper structure. So if something is painful, it's an automatic biopsy.
Yeah.
If it's bleeding and not healing, it's an automatic biopsy. So those are the easy things in my mind, even just to simplify when I educate people in the medical community, when family doctors, I'm in the same position. Like they really also are probably at the same knowledge standpoint as someone as a non-physician because
Yeah, so
they
true.
do not know the lingo. So for
Yeah.
them, when I'm educating them, it doesn't make sense for me to teach them the features of melanoma on dermoscopy, but
No.
recognizing like where your red flags, right? That's what they teach you in medical school. Know to recognize the red flags.
Yep. Absolutely. I love that. That's so true. Like every referral that I've gotten from a primary care doctor says, lesion, skin lesion. So yeah, that's so true. I think simplifying it like we have today is like really, really helpful to those non-physician, non-healthcare personnel. So I think it's also pretty attainable as well, bridging that gap. If you could tell these non-healthcare personnel any type of advice about how to look at something, et cetera, do you have anything specific, or do you feel like it's just, notice if there's changes from last time?
I mean, it's hard to know if something is changing from last time because you probably see so many scalps you're not gonna remember. But if you
Right.
see something that on the scalp is bloody, crusty, larger, not healing, tender, or you see something that looks smudgy, like smudgy is my big thing for melanoma on the scalp.
Mm-hmm.
Um, those are the things you watch out for.
Yeah.
And especially if you see like this is a big one. I've had people refer this to me from hairdressers, is a patch of hair loss with a bump underneath. That is metastasis till proven
Yeah.
otherwise. And I've gotten a lot of breast cancer, neuroendocrine, or weird things. So if you see a patch of hair loss and there's a lump underneath, or there's a patch of hair loss that you can't describe, that in itself, people don't think about that as skin
Yeah.
cancer. That is a cancer that probably has metastasized to the scalp. Anytime something is, destroying adnexal structures like hair follicles, that is a bad thing. So if you
Yeah.
see moles and there's hair growing through them, it's probably a good thing.
Mm-hmm.
If you see things where there's no hair growing within them, that's a bad thing,
Yep.
usually.
Yep.
I've
Absolutely.
gotten a number of lymphomas, cutaneous lymphomas that look like that. So you have to be careful about the things that you don't often think about, which are pink bumps on the scalp with no hair.
Yeah. Absolutely. With cutaneous lymphoma, like I had a patient who had just a small little, you know, just a bump is how she described it on her chest, and I
Yeah.
biopsied it, and it was lymphoma, and they don't always present normally, right? Like or like how you're taught. Anything abnormal, I think, is a good rule of thumb. Talking about students, college students, do you feel like they have done enough in like the public school system to educate people on UV and like the damage and photo damage that the sun
Not at
brings?
all. Not at all.
Yeah,
I don't remember that being a part of my curriculum, even in health.
me
I
neither.
definitely don't think that they're teaching that in school now. Um, and I think that some schools do allow you at least now to carry sunscreen or have sunscreen on the court. I know
Right.
I've seen that, but I don't think that they're educating people on why they should wear sunscreen, what sunscreen does. I
Yeah.
don't think that that's a thing.
Yeah, I don't either. I had no clue. Like even like 6 months ago, I watched a lecture that was talking about oh my gosh, infrared rays and damage from heat. I
Hmm.
didn't learn that in science, right? Like
Yeah.
so, or my health class. So yeah, I agree with you. So as someone as yourself with a diverse background, what advice would you have for people in the dermatology space, healthcare space that want to make a larger impact outside of a clinic, what would you recommend to them?
I mean, I think that the biggest thing you have to think of is who's your referral network. So the better you do a
Yeah.
job of educating your referral network and making those good connections, the better you're gonna do, and you're gonna get patients in early, and you can save lives. If you have
Yeah.
people that you have primary care doctors that refer to you, if you tell them like I always get like they always send me seborrheic keratoses, and I'm like, this is like
Yeah.
you don't really don't
You
need to
should
send
know
for
this
this.
by now.
Like, this is
Yeah.
not what you should be sending for, but you see a pimple
Right.
near the ear that's not healing and you've tried things, that's what you send. That's a melanoma in a 13-year-old.
Yep.
Okay.
Exactly.
So, I think you're only as good as the people that send to you. So
Hmm.
you should educate your referral network. And then if you have opportunities to donate sunscreens or things like that to schools or homeless shelters, I think that's always helpful. Those types of activities I think are huge. But I think educating people that refer to you, so not just assuming that, just don't take the referral and say, okay, I'll see this patient, but go back and say,
Right.
thanks for the interesting case. This is what I think it is. The things that you should definitely send are these things. If you see something like that again, you probably don't need to send it. So I
Right.
think that is good because you also want to best utilize your resources and their resources.
Yeah, I love that. That's so true. When I refer people to like oncology, there's one amazing physician that always calls me and she'll say, this is why it's this way, and this is what you should include next time you refer them to me. And it's yeah, we don't. I don't think a lot of specialists educate the referral network, like you said. So
Yeah.
that's a good point. And the sunscreen to homeless shelters and things is also something that's so easy. So yeah. Do you have anything that you want to add that you want viewers to know about you or about, skin cancer prevention or detection?
No, I think just, like, be open to what people are telling you. Make sure you look at your skin thoroughly. If things look abnormal, when you get your mammogram done, if they circle things, go get those checked. If you're going to get
Yeah.
your colonoscopy done and they find out things down there, I've caught basal. I've had GI doctors send me basal cells in the perianal area, which is very rare. A melanoma that was on the rectal tissue that was sent by GI.
Wow.
So like a lot of these things, like and a lot of people, they may not know what it is, but they know that it's not supposed to be there. So
Exactly.
if people are telling you things that you need to get evaluated, you should get those things checked. I would not undermine anything that anyone tells you. It
Yeah.
becomes tricky because sometimes I'll go to the zoo and I'll see. I'll never forget. I saw this thing in this guy's arm. I was like, "That's a melanoma for sure." And I was like, "I don't know what I should do. I feel like I should tell him. I don't know if I should tell him. I don't have my white coat on. It could be, it could be deemed inappropriate. Now I'm establishing a medical relationship." So those are the
Right.
things that make me nervous. Is I don't know what to do in that situation.
Yeah.
And sometimes
Did
I
you
feel
tell
like,
them?
no, I did not tell him. I did not tell him. I mean, because you have to also. It's very tricky from a legal perspective.
Oh
Also,
yeah.
I that person in particular did not rub me like it was going to go the right way just based on the conversation that he was having with his family.
Yeah.
It was a very not good, but I have in other times intervened, like if it was an older person or I was at a restaurant or I'm having a conversation with somebody and they're like, "What do you do for work?" And they'll say, "Oh, can I ask you a quick question?" Which is
Yeah.
also, you should not be doing that. You really should not be,
No.
giving, but they asked and it was a very nice, and I knew it was a genuine, my instinct was good. And I've
Yeah.
definitely found things and I've reported things. Just like when I go to the grocery store, if I see kids that have really bad acne, if they work at the cash register, I'm like, like this is the time to intervene. So,
Hmm.
and sometimes it goes well and sometimes it doesn't, but at least I feel like I know, you know, it's coming from a good place.
Yeah. Exactly. Yeah. I love that. Okay. Well, that ends the interview. Thank you so much for joining me and answering all these questions. I appreciate your perspective.
Awesome. Thank you.
Thank you so much.